Today we have joining us Dr. Chris Peltier, a general pediatrician with Pediatric Associates of Mount Carmel. He's the president-elect of the American Academy of Pediatrics Ohio chapter. Doctor, thank you very, very much for joining us. And, we relied to a great extent on your association and other professionals. And I wonder if you could just kind of give me your maybe assessment of what we all should look at and what schools should look at and parents should look at as we start back into school, and as we now are really in the very heavy process of planning, the schools are to get back going forward. Doctor, thank you for joining us.
Governor, thank you for having me. It's a pleasure to be. I wanted to start by talking about reassuring parents that might be worried. I have a child that's in high school, and I think all of us at one time or another currently are worried about sending our kids to school. What's that going to look like? And I know many of us have been waiting for this day to hear guidance from you, so we appreciate the time and effort that you and your staff and all of the organizations that took part in this to produce these guidelines. The thing I would say first and foremost to parents is that as pediatricians, we want you to know that we recognize that you're worried. We get it. We hear it all the time from you, and we know that. We, of course, want children to be safe as well. School policies, they need to be guided by supporting the overall health and the well-being of not only children, but their families, as well as the communities that they live in. The National American Academy of Pediatrics recently published some guidelines which are very similar to the guidelines that Dr. DeWine and his staff are going to be putting out today. And the national child health experts that convened that working group and produced that document have concluded that there's more harm to not being physically located in schools than not being there, and that those risks of being in school outweigh the risks of not being there. What do I mean by that? So first off, I think, and many of you know this, that while children are 24% of the population across the country, the children only make up about 2% of COVID cases. So we do know that there's been a lot of data over the last several months that support that children do not get COVID as frequently as us adults do. And for the most part, when they get it, they may not show as many symptoms and they are not as severely ill. Now, that, of course, is not an absolute. We know that there have been many children that have had severe illness and inflammatory reactions. But by and large, children have tended to do better during this pandemic than adults. These Ohio guidelines that, again, sort of mimic the national AAP guidelines are endorsed by the Ohio chapter of the American Academy of Pediatrics, which represents almost 3,000 pediatricians here in the state of Ohio, as well as all of the children's hospital in the state. But less risk does not mean no risk. So while the guidelines that the governor is producing today mitigate risk, we can never completely eliminate all risk. But we do know that kids that are in school do more than just learn math and science. They learn social and emotional skills. They have access to healthy meals and exercise. And I think one of the most important things as a pediatrician, they get access to mental health support. We are beginning to learn that there are many mental health consequences of having social isolation during quarantine. Mental health is such a big concern during these times. I know that myself, as well as my partners and other colleagues across the state, have seen a marked increase in patients that are presenting with concerns for anxiety and depression since the quarantine. And these factors that, when severe, can lead to teen suicide attempts. We know there's some data from a group of pediatricians. It was 1,000 pediatricians across the country that all share the same electronic health record. And data from that group showed that during March and April, there was a 65% decrease in the number of depression screens that were completed in pediatric offices for adolescents. So not only were children being quarantined, they weren't being seen by their pediatricians, they weren't being seen in schools, and very well may have missed many kids that were developing depression and anxiety. Kids were also missing out on the opportunity for teachers and school aides and administrators to address concerns for physical or sexual abuse, developmental delays, and substance abuse. And as we know, these concerns have much greater impact on certain populations, like African American children, children of families in poverty, and children that have learning disabilities. So what I would tell parents is, number one, stay current on your well visits and your vaccinations. During the months of March and April, nationally, the administration rate of the measles, mumps, rubella vaccine dropped 50%. We know what it's been like to live with one pandemic. Thinking about second disease coming back and creating problems is really scary for those of us that are pediatricians. So your pediatrician's offices are open. They're safe. We all have done various things to make them safe that we've heard about before. So make sure that you're staying current with your pediatrician and your vaccines. The Ohio State Athletic Association is continuing to require, thanks to some advocacy from some pediatricians here in the state and on our board, to continue to mandate yearly sports physical exams. So again, another reason to make sure to get in to see your pediatrician. It's going to be important for you to monitor symptoms. That very first point in Governor DeWine's packet is vigilantly assess for symptoms. So checking temperatures before you send your child to school, making sure that they don't have the symptoms of COVID, like cough, fever, headache, body aches, and don't send them to school if they're not going to be well that day. Work with your children, especially younger children, on hand washing and wearing masks. If you haven't taken your children out lately because of concerns of COVID, have them practice wearing a mask at school, especially those younger children or those children that may have some tactile or sensory issues. And most importantly, I would encourage families to be flexible and communicate with your children, your teachers, and your school administrators. This is a moving target, as we've seen in the last few weeks. What's reasonable right now and what's working now may not be the same come October, especially when we start to see cases of influenza. And I would like to add that I'm sure that there are going to be parents that this document, these guidelines are not going to please everybody. And that's okay. But I would remind you that you help to determine your children's outlook. If you're frustrated, share that in private. Don't share your frustration with your kids. Set them up for success by teaching them to make the best of it. Stay positive, and help teach them resilience and perseverance. If you have questions or concerns, call your pediatrician's office. You also can go to the Ohio AAP website, which is ohioaap.org.
Well, Doctor, thank you. That's all great advice. And again,